Hello, subscribers, and welcome back to The Bleeding Edge. On today's video, we're going to look into a groundbreaking study from UC San Diego here in California that's bringing hope against the battle of sepsis. Now, if you didn't already know, sepsis is a deadly response to infection, and it causes widespread inflammation and often organ failure. I didn't know this, but it claims around 350,000 lives annually here in the United States alone. But there's one single key to combating this threat, and it's a common one when it relates to disease, and that's early detection. But here's the challenge. Diagnosing sepsis early can be really tough. I asked my wife about this, who's worked on the floor of hospitals as a nurse. She said symptoms can often mimic other conditions, making really it a race against time for medical professionals. Enter Composer. That's UC San Diego's innovative new AI system. It's not only a game changer for sepsis, but it's the blueprint for how AI is going to be used in the medical field in the future. The computer system is trained on over 100,000 digital records of sepsis patients. In the hospital setting, every hour, composers review electronic health records that are incoming from the patients. It scrutinizes medications, vital stats, and more. It's designed to identify patients in the early stages of sepsis, particularly in those hard to detect cases where symptoms are unclear to doctors and nurses. And as we've talked about with AI really since the beginning, this isn't about replacing doctors or nurses. Instead, Composer acts as a support tool, prompting the healthcare providers to take a second look at the high risk patients. The study involved over 6,000 emergency patients in the San Diego area. With Composer, the sepsis mortality rate dropped to 9.5%, saving an estimated 22 lives. And the university isn't going to stop there. They're expanding Composer's use, exploring like wearable sensors for real-time data, and even integrated large language models like OpenAI's ChatGPT for even deeper insights. And this is just the beginning for this type of medical treatment. Earlier this month, I personally met with a founder who's treating the most difficult cancer patients. He's using a similar method to this. Soon, monitoring patients in real time in a hospital setting using AI is going to be the norm. And groundbreaking drug discoveries will come from the compiling of large data sets from patients. Yes, AI is going to have some challenges going forward. People will use AI for nefarious purposes. Criminals are going to use it too. Politicians are going to use words like existential threat to democracy to describe AI. But the reality is, AI is already saving lives. And if it's myself or anyone I love, including you, facing a battle with sepsis, I'm glad AI will be there to help. AI is not just a buzzword or an investment thesis or a way to make money in the stock market. It's a lifesaver. UC San Diego's study is a glimpse into the future where technology and healthcare work hand in hand to save lives. What do you think about this? What do you think about Composer and the role of AI in medicine? Are you feeling more or less worried about the dangers of AI than, say, a few months ago? Let me know what you think. I'd love to hear from you. That was today's newsletter. Hopefully, you guys have a wonderful day, and I'll see you again soon.